Let's get real. Can you actually make your penis bigger? If you're a young boy or 50+ years old, you might have seen ads promising miracle growth, pills, pumps, surgeries, but is any of it real? Today, I'm giving you the no-nonsense, science-backed truth about penis enlargement. What works, what doesn't, and what actually matters for your health and confidence. Hi, I'm Dr. Zoe Hartley, and if you're a man over 50, this channel is for you. We talk openly about real health issues most guys won't bring up, especially ones wrapped in shame or silence. The idea of getting bigger is loaded with emotion, self-worth, aging, masculinity. But let's take the heat out of it and look at the facts. No hype, no judgment. First, let's be clear. The average erect penis is about 5.1 to 5.5 inches long, and 90% of men fall within an inch of that. So unless you're significantly below 4 inches when erect, you're probably within the completely normal range. But here's the real question. Can you actually increase your size? Physically? Permanently? Let's start with what doesn't work. No. 1. Pills and supplements. There is zero scientific evidence that pills can permanently enlarge the penis. Many are full of herbal blends with no clinical backing, and some can even mess with blood pressure or liver health. No. 2. Pumps. Vacuum pumps can make your penis appear larger temporarily. Great for erectile dysfunction, but not permanent. Once the blood flow decreases, so does the size. No. 3. Stretching devices. Devices like extenders may lead to very modest gains, we're talking millimeters, with months of consistent, uncomfortable use. For most men, the trade-off isn't worth it. No. 4. Surgery. Surgery can involve cutting ligaments or injecting fat, but it's risky. Scar tissue, loss of sensitivity, erectile dysfunction. Many men regret it, and even the best results don't drastically increase size. So if most methods don't really work, is there anything you can do? Yes, just not in the way you might think. No. 1. Lose belly fat. Even 10 to 20 pounds of fat loss can uncover length that's hidden by your abdomen. No. 2. Improve blood flow. Better circulation leads to stronger, fuller erections. Regular exercise, heart-healthy food, quitting smoking, these improve vascular health and function. No. 3. Treat ED. If you're dealing with erectile dysfunction, it might feel like your size has changed, but the issue is firmness, not length. Medications, pumps, or lifestyle changes can restore function and confidence. Here's what matters more than size by a mile. Your ability to get and maintain an erection. Your confidence and communication. Your health, which drives your energy, libido, and performance. In study after study, partners rate emotional connection and communication far higher than penis size for sexual satisfaction. And remember, porn is not reality. Those are paid actors selected for specific reasons. You are not broken or small, you're human. So, can you make your penis bigger? Not in the way those ads promise, but you can become healthier, more confident, and more satisfied. And that starts with understanding what really matters. You're not defined by a number on a ruler. You're defined by how you treat your body, your partner, and yourself. If this helped shift your perspective, or cleared up confusion, hit the like button. Subscribe for more honest, fact-based health talk for men and young boys. And drop a comment. What topic should we cover next? Coming up next, we're diving into, why can't I get or keep an erection?